Hello everyone. Welcome to today's live presentation. I welcome my viewers on LinkedIn, Facebook as well as YouTube. And today I'm going to speak on the topic ImmuLIT. Is it really beneficial in miscarriages and IVF failures? I'm Dr. Mohan Raut. I'm a practicing gynecologist and clinical reproductive immunologist. We have our centers in Mumbai and many other parts of India. And at these centers, we treat couples with patients who have unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using lymphocyte immunization therapy, the patented form that is ImmuLIT, and other immunomodulatory medications. Our centers are known as Dr. Raut's Centers for Reproductive Immunology. So let's come to today's topic, ImmuLIT, whether it is a beneficial treatment for miscarriages and IVF failures. Now, ImmuLIT, as you all know, is our patented branded form of lymphocyte immunization therapy, and it is an active immunomodulatory treatment. That is, it uses lymphocytes from husband or donor to induce immunological changes, to be specific, production of protective or blocking antibodies and T regulatory cells in couples who have so-called unexplained reproductive failures, that is miscarriages and IVF failures, because of alloimmune problem. Now, why I am talking on this topic today? Because very often we are asked this question, that in the topic of my talk, that is, doctor, is ImmuLIT really beneficial for patients who have miscarriages or IVF failures? Now, why this question is asked? There are three reasons. I feel there are three reasons. One or three things related to this question. First is that common objection is this treatment is not practiced at many places or is hardly practiced. The second question is there is no awareness about this treatment among doctors or amongst the common people. And third is there is no evidence that tells that this treatment is beneficial or useful. There are no studies showing that. Now let us see what are the actual facts behind these so-called questions or queries. The first thing is it is not commonly practiced. It is absolutely wrong. Let me tell you that this treatment of lymphocyte immunization therapy is practiced globally. It is practiced in Canada, it is practiced in Mexico, some South American countries, it is practiced in Europe, including UK, Germany, other European countries, Middle East countries, China, India, Sri Lanka. So there are many places where this treatment is practiced, and the statement that this is hardly practiced is not correct. So that is one. The second is there is lack of awareness. Now, because the query is that there is nobody knows about it, so therefore this treatment is not beneficial. That is not right. Yes, maybe less number of people know about it currently or at present, but as more and more information about this treatment is coming, there will be more awareness. As more number of patients who have been benefited by this treatment will be known to people, the awareness will still increase, because for those who really require it, this awareness is very important. And let me tell you, this treatment is not for everyone. This is a select group of patients, and therefore maybe it may take time, or it has taken time for the awareness to be created. So that is the second question. And the third is there is no evidence about it, or there is hardly any evidence which says that this treatment is beneficial. So about that I'm going to speak in detail a little later, but that is also not true, because there is now strong evidence that shows that there are strong studies, recent studies, which show that this treatment has beneficial effect in well-selected group of patients. So for that matter, for any treatment, let me tell you, any medical treatment or medicine, for it to be beneficial, especially therapy to be beneficial, there are three things again which are important to know. First is whether it is given to the right group of patients. So the selection of patients is important. So the investigations. So the right investigations are required to find out which couples we have this problem, and then to treat them because this is a personalized treatment. So therefore, proper selection is very important. So that is the first thing. Second is the method of treatment. Now, the treatment has to be given with the right method. If the treatment is method is not correct, definitely the results will not come. And the third thing is that the treatment has to be safe. Okay, so it has to be given to properly selected patients, done with right method, and third is it has a high safety profile. So if you consider ImmuLIT treatment, then in all these three factors, the ImmuLIT treatment that we give at our center, is all three factors are satisfied with respect to ImmuLIT treatment. It is given to properly selected couples. We do immunological investigations, the lymphocyte cross match, natural killer cells or NK cells in the peripheral blood as well as in the endometrium, especially the CD57 type of cells, the serum TNF alpha, the inflammatory cytokine in the mother's blood, antithyroid antibodies. So these tests basically help us to find out couples or select couples who will be benefited by ImmuLIT treatment, and only to those couples this treatment is given. Second is the correct method. Yes, that is our specialty, that we have a patented process and which has proven its efficacy over last so many years for more than 4,000 couples who have been suffering from had been suffering from miscarriages or IVF failures. So therefore, the method is no question. And the third is safety profile. Yes, this treatment has very high safety profile, and it's not associated with any severe allergic reactions when it is given. It doesn't suppress the immunity of the patient. Very important. It's not an immunosuppressive treatment. There are no long-term complications which are otherwise seen with immunotherapies, that is the autoimmunity part or generation or graft versus host disease. So it's a very safe treatment. There are no adverse effects on the baby also. It is can be given in pregnancy also. So from all these 3 points of view, the ImmuLIT satisfies all these 3 criteria, which are of the selection, the right method, and the safety part. And not just I am saying this, but there are large studies which have shown that the lymphocyte immunization therapy is a safe treatment where the patients are followed up for years after the lymphocyte immunization therapy treatment. So therefore, all these 3 important factors are satisfied. So then what the next thing that will prove that it is really beneficial is the evidence. Now, as I mentioned, one of the queries that is put forward is there is no evidence. This is also not true. Therefore, I am going to go a little more in detail about the evidence that is there about lymphocyte immunization therapy. Now, in the year, say, 1999 to 2003, 2004, there were certain studies which showed that lymphocyte immunization therapy is not effective, especially the REMIS study, which is also called as the OBER study, which showed it is not effective. Of course, that study had many flaws and it was later on kept aside. But after that, after 2003, 2004, there are so many studies have come up which have shown that lymphocyte immunization therapy is effective. In fact, in our recent book that we have published on lymphocyte immunization therapy, published by Springer, we have analyzed all these studies related to lymphocyte immunization therapy and their efficacy, and they have shown excellent success rate. So whenever a success rate or when these studies are analyzed, individual studies are not considered, but what is called as a meta-analysis is done. So all the studies are considered together, and then the success rate or the chances of success are found out. So if we see the older meta-analysis, they have shown that it is not effective. But from say 2016 onwards, if we see the meta-analysis, then they have definitely shown higher success rate or beneficial effect of lymphocyte immunization therapy. In 2016, the LEW study has shown an efficacy which is expressed in the terms of odds ratio. If you express it, then it is 4. So odds ratio is a figure that tells us that if you give a particular treatment, then what are the chances of success compared to the group which is not given. So if the odds ratio of 4 means the chances of success were 4 times higher for couples who were treated with lymphocyte immunization therapy compared to those who were not treated. So subsequent meta-analysis showed similar results. In 2017, Cavalcante meta-analysis showed an odds ratio of almost 3.3, 3.4. Even recently, in 2021, the recent meta-analysis of 21 studies has shown an odds ratio of 3.22. So more than 3 times the chances of success are there. So these studies have shown that lymphocyte immunization therapy, it is an effective treatment, and therefore it is beneficial for couples who have repeated miscarriages or IVF failures. Now here I would like to briefly mention, as I always mention in my talks everywhere, that the evidence related to any treatment is very important, because that's what leads to the clinical practice. But this evidence, or the practice that is related to the evidence, is also called as evidence-based medicine. And recent definition, or recently, evidence-based medicine has now 3 parts, and only one part is the research evidence. So what we just discussed is just the one part of evidence-based medicine. The second part is the clinical experience of the doctors who are actually treating patients with lymphocyte immunization therapy, and finding out what is the success rate, or clinically what is the success rate. And the third part of evidence-based medicine is the patient preference. What does the patient want? Yes, we just can't do whatever the patient says. That is right, patient may say anything, but we can educate the patient, we can give information to the patient, and let the patient take informed decision, and then we can include that decision in the evidence-based medicine to decide the plan of action for the treatment. Because I am very sure, and you also will agree with me, that if we just follow the evidence-based, just the evidence that is there from the research, then yes, we will definitely get good results for the patient. But if we incorporate our clinical experience into it, then, and the patient preference, then definitely we get the best results. And therefore, for any doctor who combines the research evidence with his clinical experience, is definitely a superior doctor than the one who just follows the research guidelines. So therefore, friends, it is very important here to understand that lymphocyte immunization therapy, the way we do it, ImmuLIT, is a beneficial treatment. And I would like to summarize what I have just mentioned here, that the common objection that it is a rare treatment, or it is there is no awareness, or there is no evidence, these queries are incorrect. I have given the details of that. Then the 3 criteria that are required for a beneficial treatment, that is the proper selection of patients, the right method, and the safety of the treatment. All 3 criteria are satisfied with ImmuLIT treatment, and the evidence with the different studies and the meta-analysis also show that lymphocyte immunization therapy is an effective treatment. So therefore, as a conclusion, one-line conclusion, I will say, as an answer to the question that I put forward at the beginning of my discussion, and that is, ImmuLIT, is it beneficial for miscarriages or IVF failures? The answer is yes. And if you want to know more about ImmuLIT, or if you know someone who may need this treatment, you can contact us on our helpline number 9833201522, or you can visit our website www.icprm.in. And please share this information to at least one couple, I would say, those who are looking for solution to their problem of miscarriages or IVF failures or infertility. And I am sure you will help that couple fulfill their dream of completing their family or having their own baby.